Hello and welcome to CIO Leadership Live. Today, it is my pleasure to welcome back Vineet Purushottamam, Group CIO at Aster DM Healthcare. Hello, Vineet. How are you?
I'm very good. Thank you so much, Andrea, for having me on the.
Thank you so much for joining again these sessions. In this case, we have a lot of things to discuss. First of all, many congratulations because you have been awarded top 3 in CIO 50 Middle East Awards. Many congratulations for that. And also, we have been discussing a lot about Gen AI, specifically in the healthcare. It is a revolution. Gen AI is enabling faster diagnosis and personalized treatments. But how AI and big data are changing the healthcare in the Middle East?
Yeah, so that's true. Generative AI or Gen AI, as it is called, is a very promising set of tools, because I say it's not just one tool that delivers, it's a set of tools that comes together to deliver that outcome that we're talking about. So Gen AI is one of those set of tools and solutions that come together to deliver some very significant outcomes in healthcare. And I believe particularly in enhancing the patient experience, and the most obvious thing that that happens that differentiates healthcare from every other industry is anything that you do with technology and enhances the patient experience and touches patients' life is very different when you do it in any other industry, which is why when technologies like Gen AI and many of these new age technologies come and play a role in healthcare, I believe the value of that technology is 4 times what it is in other industries. Well, it's all about human beings. It's about life. It's about saving people's life. It's about making people's life better, getting a faster recovery, and which is why it's very special. So a few use cases that come to mind is so generative AI, like you said, is a lot about, in very simple terms, a set of tools coming together, working on a particular logic, looking at the data, and in the case of healthcare, the data we're talking about is patient health record, or what we call as the electronic health records, and that is a lot of data. That's a lot of data. When you do one consult with the doctor, you can understand in olden days when you go home, you carry a. Nowadays it's all digital, so the data is huge. So when technology can come together, the Gen AI is able to look at the data, and there are 2-3 very obvious use cases that come to mind. One is that.
Perfect. I was going to ask you about those use cases, so please.
Yes. Yeah. So I said the use cases, the obvious use cases that come to mind to me is one around using Gen AI, working on the patient health record to come out with some personalized treatment plans. Now, the only difference that I would like to bring in here is these treatment plans will always be reviewed by the doctor before it is released. Because in the healthcare, for any technology deployment, I always feel it has to be initially a second opinion and not the first opinion. The doctor should be the final authority to decide what goes out to the patient. So, but then there is a lot of potential if a Gen AI solution can work on the electronic health records of a particular patient and come out with very specific treatment plans. And that is going to be, that is already a very, very obvious and very amazing use case. The second use case that comes to mind is using Gen AI to enable the administrative staff. That is, in a healthcare environment, whether it is the nurses or the paramedics or the doctors who work to make data entry onto systems, on the hospital management systems and on the EMR, they can get a lot of help with Gen AI prompting them rather than they having to type the whole thing. So there are a lot of tools that are being deployed. We are also trying many of those where the Gen AI tools sitting on top of the electronic records help the administrative team do their work more efficiently.
I wanted to ask you, Vinay, because I remember we both attending a session about GenAI healthcare at GITEX. And I mean, we all know the benefits of GenAI, how beneficial can be to get an early diagnosis. But the problem that some of the CIOs were saying is that they say, I only have access to my own data, to the data that I have in the hospital. So if we are talking about a new customer, I cannot really see all the benefits of it. So it depends. If you have been coming to Aster DM since you were born, you're gonna have access to all of the data. But what happens if you are new at Aster DM? How do you manage that? Because you don't have all that background information.
No, so two parts to this, right? So one is in a place like Dubai, in a place like UAE, the government is also working with the private players to enable this. So there are two layers of data we can think about. Aster has all the data that about their patients who have come and taken treatment from us. So if you have come to any of our Aster hospitals or our clinics, we obviously have your data. So we know that we've taken care of Andrea, and Dr. XYZ has seen her, and how many times, all to have all the data, right? That is one. But I also have access. When this data actually goes into the HIE, the NABID and the Malafis and the RIITs, there are various health information exchanges that are there within UAE. And the clinicians have even access to that information, right? Which then helps. When I even know if you have seen a doctor in any other hospital beyond Aster as well, the data exists, and we have access to that data for a patient because we have the consent from the patient, right? So if you have to use a Gen AI at working with the regulators, working with DHA, which is what DHA is now doing, you could actually bring in all of this data together and do things to benefit the patient at large.
How are you using Gen AI at Aster DM, and also when implementing those initiatives as a CIO? What are your concerns?
I must say concerns. I'll start with the concerns because that's always there. Any new age technology, and I keep saying this, any deployment of technology in healthcare is very different from deploying technology elsewhere. I repeat that because it's very different in healthcare because it's all about people's life. It's all about people's health. Therefore, that is a key aspect. However, the next important piece, I would say, I wouldn't call it as issues, but these are challenges in the way, is the quality of data. So it's all about AI, and Gen AI is all about the quality of data and the logics running on the data. Logics we can keep trying. We can keep iteration over several iterations. You can crack the logic. You can get it right. But the data is something that you have to continue to ensure that the data is correct, data is clean, right? So challenges always be data, because if a logic that is correct runs on a wrong data, the outcome is going to be wrong, right? And then the outcome comes wrong for a patient's health is very, very critical. So that's which is why I said always has to be a second opinion and not the first opinion to begin with, till the time you're comfortable with the whole thing. Now, at our Aster hospitals, we have tried using generative AI for the administrative aspects, where it prompts and helps my doctors and clinicians while they do the administrative work of entering records. That's where we have started. I know that DHA and the regulators that we work with, they're also trying various options, to which we'll be very, very closely working with.
Vineet, do you think, and I think we talked about this first time I interviewed you, do you think healthcare companies will increase their IT budget?
Is the question saying will the healthcare companies increase their IT budget?
Yeah, if they shall increase the debt budget.
So it is So it's like I'll answer that in two ways. Nobody wants to increase any budget because in healthcare, the margins are always a problem. However, I don't think anybody has a choice but not to increase investment on technology. Right? I'll say it's not about if IT is seen as a cost, if IT is seen as a spend, then it's a different discussion. Then you don't want to spend. But IT is seen as an investment, and that changes has definitely happened in healthcare post the pandemic. Everybody has seen how technology, without technology in healthcare, it's not possible to make healthcare affordable, to make healthcare accessible, right? And it's so that's therefore automatically I don't think anybody has a choice but to invest in technology. Yes, investments will have to have very clear outcomes. These investments have to be very clearly measured, and so that the business sees benefit of it. That's how I'll put it. Yes. So your answer to conclude, yes, there will be additional money that comes into IT, but I take that as an investment and not as a cost.
That's wonderful. And last but not least, what are your top priorities as a CIO for 2024?
There are a couple of them. The topmost, obviously, will continue to ensure the patient experience across our hospitals, pharmacies, clinics, and all the verticals that we operate in, and the online is seamless. So that's one thing right on the top of the agenda. Because at Aster we work across the various services and across Emirates. The topmost agenda is to ensure that any patient coming into a hospital or a clinic or a pharmacy experience is a seamless has a seamless experience and a consistent experience. That is definitely topmost at the agenda. Another one, obviously, is to ensure that all our patient data is secure, to ensure that the whole security aspect of all our systems within our hospitals and online is secure. Like, the whole cyber landscape is strong enough. So that's another big priority. And we are growing. We plan to grow beyond in GCC and beyond, which is why solutions that are going to be deployed are more going to be on the cloud and on SaaS models, so that we can then scale faster.
Vineet, we wish you the best to you and Aster DM hospitals and Aster DM that's team. I was gonna say that's company. Thank you so much for your time. I know how amazing work you and your team are doing. So many congratulations and thanks again for your time.
Thank you so much. Thank you so much, Andrea. Thank you.